It's Get Well Wednesday. Welcome back from Pfizer, Dr. Frida Lewis Hall. Good morning. How
Good
are you?
morning.
You good?
I am doing just fine.
All right. The topic this morning is atrial fibrillation or AFib. That's when it makes your heart flutter?
That's exactly right. So, but why are we talking about atrial fibrillation?
Yeah.
First of all, because it is a significant risk factor for stroke, but it often goes undetected. And my mother died of a stroke when I was in medical school. And so it is really in my heart to try and make sure that people understand the risks and then address them. So what is AFib? It's a common type of an arrhythmia. That's a condition in which the heart beats too slowly, too fast, or in an irregular way. This irregular heartbeat makes it hard for the heart to pump enough oxygen-rich blood to the rest of the body. When the top chambers of the heart, or the atria, do not contract properly to pump the blood into those lower chambers, the blood kind of sits around. It can pool and form clots. These clots can then travel to the brain, blocking or limiting blood flow. That may result in a stroke, which, of course, can be debilitating. Now, AFib can occur. It's kind of tricky because it can occur in episodes like come and go, or it can be a permanent condition. But it's common. It's projected to affect up to 8 million Americans in 2019.
And African Americans?
And African Americans, importantly, well, let me add, though, age. Age is a factor. So for people 65 and older, it's really important to understand what atrial fibrillation is, how it increases your stroke risk, and the need to consult your physician.
Do you usually become aware of it after, because it seems like friends of mine or people I've heard of after 50 for some reason?
Yeah, so your risk goes up after 65, even more so, but anybody can have it, so it's really important. Now, regardless of race, not enough people know about this. In an analysis of about 3,500 people who developed AFib, the results showed that compared to Caucasians with AFib, African Americans with the condition have a higher risk of stroke.
Here we go
both
again.
before, mo better problem. We got a mo better problem. So both before and after their AFib diagnosis. And then in the same analysis, African Americans with a new diagnosis, listen to this, were 62% more likely to have had a stroke before AFib diagnosis than were Caucasians who developed it. And if that were not enough, another analysis of about 12,000 patients, African Americans were found to be less likely to receive a blood thinner compared to Caucasian patients to help manage their AFib.
So, Dr. Frida Lewis Hall, you are here with us as a part of our Get Well Wednesday initiative, and you're going to be our month-long expert and talking about health issues in AFib. What about the signs, and how do we know if we have AFib? And obviously, we should be going to the doctor, but definitely if something it doesn't feel right.
Yep, so I talked about these well-established risks for stroke. Despite all of that, it often flies under the radar. Sometimes there are symptoms. So like heart flutters, pain in the chest, dizziness or shortness of breath. But it's possible that a person's AFib can come and go, or that there are no symptoms at all.
Oh, great.
But it can be, so steps to detect it, though, are sometimes simple up front. You have your doctor do the pulse palpitation, a little thing with the finger on your wrist, or to use a stethoscope to listen to your heart. And what they'll be doing is checking for the rhythm and the regularity of your pulse. And then sometimes an EKG, which kind of shows the heart's electrical rhythm, can be used to confirm an AFib diagnosis. So, and sometimes the more difficult challenges can be that if a patient has no symptoms, there are procedures like blood tests, chest x-ray, chest tests. There's a monitor that you wear for a while that records your heart's electrical activity called the Holter monitor, or they can do another specialized test called an echocardiography or echo, which can reveal the presence of AFib even when there are no symptoms.
Can it be genetic? Like you said, your mom had this.
Well, I don't know that my mother had AFib. This was back in 1977, and we didn't know her, but she did have a stroke. And that's why this is so important. And a lot of people don't know or understand this. So we have a Matter of Moments initiative. We did a Harris poll, the Bristol-Myers Squibb Pfizer Alliance. We did about 1,010 U.S. adults. Now, here's your question. We did age 40 and older to see what people understood about this AFib and the stroke risk that goes along with this. And the survey results are a little scary. So many adults 40 and older, 61% as a matter of fact, are not familiar with AFib at all.
They just think it's a small lie.
Yeah.
Yes. Small
yes,
lie.
I love it. Yes, a little fib. Now, on top of that, though, the survey suggested that many undiagnosed adults age 40 and older with one or more risk factors, this is 89%, may not believe or aren't sure that they're at risk for AFib. And then back to this the higher risk group, the 65 and older group.
Yeah.
58% don't know that their age puts them at an increased risk for AFib.
Okay.
So we have a lot of work to do to get the community to understand what AFib is, who's at risk, and how to get it checked out.
All right. For more information about AFib, visit A Matter of Moments. That's one word.com. A Matter of Moments.com. See you next week, Dr. Frida Lewis Hall.
All right. See you then.